Welcome to the Taking Care of Tutu podcast. My name is Meg Obanoff. Today, we're happy to have Angel Nelson. She works at Maui Memorial Medical Center, and her job is she is the Tumor Registry Supervisor. So, welcome, Angel. Thanks so much for being here.
Thank you for having me.
Uh, so, what is that? What is the Tumor Registry Supervisor? Tell us about it.
Well, my credential that I hold is called an oncology data specialist. So the letters after my name are ODS. And what we do is catalog and keep a library basically of every cancer case reported, meaning that that patient had to be diagnosed or treated at our hospital on Maui.
Mhm.
And since we only have one hospital, we treat almost everyone or diagnose almost everyone. There are just a few outliers like Kaiser, but the majority of them seem to come through us.
So, if someone has a procedure, they have their surgery at the hospital here on Maui, then their information becomes part of the tumor registry.
Correct. It's like their story becomes a little book in a library, and then we transmit those stories to the state, and the state compiles an even larger library where your book is over there too. And as we
Mhm.
update and send those updates to the state, they keep updating that same story. And then that story goes to Washington, D.C. and represents our numbers nationally.
Okay, and what's the purpose of it?
This information is what researchers use in order to gauge how many cancer clusters they might identify in a region, whether there might be an environmental um, problem somewhere that's affecting people. Any
Say
researcher,
more about that. If there was all of a sudden a bunch of cases of a certain kind of cancer in the one geographic area, then they might think, wonder what's going on with the water and with everything else in that community.
right? And given things that with our geography, we're positioned in the ocean where there's a lot of ships going around us, and we just recently had the Lahaina fire. So those types of environmental factors are things that we also record in our information for those stories.
And so does it make you feel like you want to help people get their cancer screenings, that you want to talk about preventive care?
Yes. I noticed because I didn't always work on Maui. I used to work in California.
Mhm.
I'm originally from Big Island, but did my schooling in California. So I didn't come back to Hawaii until 3 years ago. And it's very surprising to see the difference in levels of care and um, levels of concern, I guess, from our community members about cancer and screenings. So I'd like to, let them know it's not so scary and that they should go do it. It's very beneficial. The pros outweigh the cons.
So are you saying that compared to when you were working on the mainland, you found that people on Maui were like sort of more reluctant to get their cancer screenings done?
Correct. I see a lot of patients declining,
Oh,
either wanting to go get a mammo or a colonoscopy or a biopsy. And I just want them to know that it's not that scary. Like the pros always outweigh the cons. So please go and get checked out.
so that's really interesting. So I know that this is not like hard research you've done or anything, but like, what would you say the difference was between people in California and people on Maui being willing to get their screenings?
In
Like what,
California, like
I know you don't have a
biopsies,
percentage, like I know you don't have a
maybe
percentage,
not a
but
percentage, but more often than not, when a patient is told that they should get a biopsy, they go get a biopsy.
in
And here,
California.
yeah, I'm here. I hear all the time now, oh, like, no, it can wait. It can wait. And I don't know if it's we're not emphasizing enough the importance of it. So if that is the problem, I'd like to help bridge that gap.
What are some early warning signs of cancer that seniors might mistake for like normal aging?
Good. That's a really good question because
Oh, good.
I
Thanks.
see a lot of patients come through the registry where they said, "Oh, we just thought it was X and it turned out to be Y."
Uh,
Um, a lot of it is altered mental status is what we call it, like forgetfulness,
mm,
or they're agitated and confused, and they go, "Oh, well, maybe it's just, mom's got early onset dementia, maybe that's it." But
yeah.
if you know someone's acting oddly in a way that they've never behaved before, or, obvious that their face starts to droop, things
Mhm.
like that, or they can't see, all those are signs that there could be something in the brain, a
Mm.
tumor, whether it could be cancerous or not, or it could be a metastatic cancer from another site.
And I
Uh,
can see how people would just assume that's part of the regular aging process.
correct. Another one is like severe indigestion and hiccups.
Mhm.
That can often mean a GI cancer or
Mhm.
possibly a biliary cancer like pancreas, liver, and those ducts that work in and out of there. Um, so hiccups, like, and they'll say, "Gosh, they're ridiculous. They're hurting me." When they start to
Oh.
say that, like it's time to go get checked out.
Mhm.
Um, change in bowel habit or urinary habits.
Mhm.
Oh, it's auntie's getting older. She's shishing more. And, oh, well, is she? You know,
Mhm.
is there an odor? Does the urine look normal? Is there blood? Is
Mhm.
there granules? Be diligent when you're looking after your loved one. If you start noticing something odd, take a second look a little deeper at it. Bowel
And
habits.
are you talking to family members too? Because in this population and seniors, they're not gonna go to the doctor until, like, it's super terrible.
Yes, and I work behind the scenes, so I don't get to talk to these people. I feel like I know every single one of my patients, but they don't know me.
And
And
in the past when you were working with
oh,
patients?
for sure. Yeah. And
Yeah.
it's always, I've been lucky to work with doctors who believe a patient's care should be a collaborative discussion. So that includes the caregiver and
Mhm.
making sure everyone's on the same page.
So you were saying you just named 4 different kinds of cancer that are pretty common in Hawaii. You said colorectal, breast, and what were the other 2? You said
Prostate,
lung, prostate,
lung,
and
and
lung.
and the other one are the biliary and pancreas ones, and those.
I actually don't know what biliary is.
So biliary system, this is like our body's filtering system. So we're talking
Mhm.
about your liver and your pancreas and the little ducts in between them and your gallbladder. Those all make up your little biliary system.
Oh,
And they're also close together that by the time the cancer's caught, it's usually involved more than just one part.
mhm.
And that's why pancreatic cancer, as we know, and as we know, like poor Patrick Swayze, how quickly he passed away after his diagnosis, that it is not a curable cancer. It's something that can go in remission, but you can't live without your pancreas. And um, the surgery can only remove parts of
I
the
see.
pancreas with the tumor.
I
Yeah.
see.
Yeah, so those are also gonna be at a higher number with patients who consume more alcohol in excess and smoke, of course. Same with the
Okay.
lung. Lung
Okay.
is usually smokers, but not always. So patients who have asthma. My mom has asthma and she's 71. She does not smoke, but she has little, it's called granulomatosis. They're like little granules in her lungs. So
Mhm.
she has to get lung screening every year, which is just a quick CT, takes all of 10 minutes.
Mhm.
And that's it. And that's all you have to do. If you are a smoker, you should be getting lung screenings. You should be talking to your doctor about that. if you're not already talking about smoking cessation, you should also
Yeah,
talk
I was gonna
about
say you
that.
should also probably stop smoking. Yeah. So what
Yes,
would I mean? That's a real kind of a low hanging fruit, I guess, for prevention would be quit smoking.
absolutely.
Don't drink excessively. What would be some other suggestions that you would have?
Well, we live on such a gorgeous island, and all of us have no reason to not get out and stretch and, touch the grass and smell the flowers and move our bodies. That's all super healthy for our minds and our bodies. So let's take advantage of the high cost of living here and enjoy what's around us. That's going to keep us healthy for sure.